Bismillahirrahmanirrahim. Dear students, Assalamu alaikum. Our today's lecture or discussion is hemorrhagic septicemia. As you know that we are studying different important bacterial diseases of animals. So today the disease I have selected for you people is another important disease that is very prevalent in Pakistan, and this disease is known as hemorrhagic septicemia or simply HS or Gulghoto in Urdu. In Urdu, it is known as Gulghoto because of specific signs or symptoms that appear in this disease. So, hemorrhagic septicemia is an acute bacterial disease of mainly cattle and buffaloes, sometimes sheep and goats and camels, and is clinically characterized by high fever, swelling at throat and neck, severe dyspnea, depression, and high mortality. So this introduction is gives you an idea what happens in this disease, what are important clinical signs and symptoms. So the most important clinical sign and symptom is the swelling at throat and neck, resulting in difficult respiration, which is known as dyspnea. So because of this reason, we call this disease Gulhoto in Urdu. And it is one of the major diseases of cattle and buffaloes in Pakistan. Etiology. This disease is caused by a gram-negative non-spore forming capsulated bacteria called Pasteurella multocida. This bacteria has different serotypes. Among two important are Asian B2 and African E2. In Pakistan, serotype B2 is the more common serotype found. So you have to remember this point that serotype B2 exists in Pakistan and it causes hemorrhagic septicemia outbreaks. The disease epidemics occur during monsoon season. So as you know, in Pakistan during the months of July, August, we have rainy season that we call monsoon. And during monsoon, there is high environmental temperature and humidity, which results in stress among animals. And because of those stressful conditions, this bacteria multiplies and cause disease. Now we come to the transmission. This bacteria usually inhabits in nasopharyngeal region of buffaloes and cattle, making them carriers of this disease. And among 5% of population of cattle and buffalo may be carrying Pasteurella multocida in nasopharyngeal area. But it is mostly transmitted by respiratory route, by direct or indirect contact with the sick or carrier animals, and it can also be transmitted by oral route by ingestion of contaminated feed and water. Now we come to the risk factors or predisposing factors which results in putting the animals at risk of having this infection. So all those conditions which predispose the animal to stress can result in HS. The first one is poor nutrition, which is simple to understand, because if the nutrition is not good, or if the animal is not fed properly, the animal will be in stress and the immune system becomes weak. Similarly, stress due to fatiguing exercise or overworking, like if you use the animals, cattle, buffalo, for long distance transportation, if you put heavy workload on them, so of course the animal will be stressed. Similarly, another very important reason that I discussed earlier is the hot and humid season. As it is true for animals, you can also, as a human, can also feel that when there is humidity, more humidity, and the temperature is very high, so the person gets uncomfortable. The person feels uncomfortable. So the same thing happens in animals as well. Similarly, if there is any pre-existing infection or comorbidity, like any pre-existing disease, so the animal or viral disease specifically, so the immune system will be not working very well up to the mark, and it will result in the HS infection. Similarly, the presence of carrier unvaccinated animals in the herd can also predispose healthy animals to this infection. Now we come to the clinical signs and symptoms. As you students are not the veterinary students and you are not going to treat the animals, but it's just to have an idea what happens in this disease. So the most important sign and symptom you have to remember is the inflammation of the throat and upper respiratory tract, and there is septicemia. Septicemia, when there is bacteremia plus toxemia, it means when the bacteria are multiplying in the blood and they are producing toxins. So this condition is known as septicemia, and it is very dangerous condition that results in many other consequences. For example, one of them is very high fever in this disease, and in per acute case, you may find the animal dead at the spot without showing any other clinical sign and symptom. So you have to remember this point, that swelling will be seen at the throat and neck region, which will press the trachea, and it will be difficult for the animal to respire properly, resulting in dyspnea or difficult respiration. So now we come to the another important part of this lecture, that is the lab diagnosis. So as for other diseases, like we are discussing another bacterial disease, the first step towards diagnosis of HS is the isolation and identification of bacteria by culture. So to grow bacteria, Bacteria multicedia, you can use different type of media like blood agar, which is of course not a selective media, but Bacteria multicida can be grown on blood agar as well. But if you want to culture it on a selective media, so you can use CSY agar, casein sucrose yeast extract agar. This agar is, or we can also use CSY broth. This is mostly used to grow the bacteria for production of the vaccine, because when you grow or culture this bacteria on this media, CSY broth or CSY agar, there will be a good development of capsule. Similarly, if you want to check it in lab animals, you can also do animal inoculation. If you have a sample from the field and you inject it in rabbits, so it will result in the death of rabbits after a couple of days. And you can isolate this bacteria from the different organs, especially the bone marrow of the rabbits. Similarly, we can also use different serological tests, and among them, ELISA is the most sensitive and specific, but it is not commonly done because of its high cost. So, in the field conditions, the clinical signs and symptoms and history is quite sufficient to tell a veterinarian that this is the outbreak of HS. But if the animal is dead, already dead, so the veterinarian can send different type of samples from dead animal. Even if you take a long bone, you can put it in fridge or freezer, and you can preserve it for a long time. And if you want to culture bacteria, you can cut that bone and can take out bone marrow, and you can culture this bacteria from the bone marrow of the infected animal. Last but not the least, you can use molecular techniques like PCR to identify this disease more specifically on genetic level, or on, if you want to know the genotype, you can use PCR. Treatment. So treatment, because it's a bacterial disease and it responds very well to antibiotics, but the antibiotic treatment should be initiated as soon as possible. Similarly, the animal is also given supportive treatment like anti-inflammatory drugs and antipyretic drugs. Now we come to the another most important part of this lecture, that is the control and vaccination. Control and prevention. So it is the control and prevention is mainly done by vaccination. So the vaccines are available in our country. Most of the time we use the killed vaccines. So the vaccine should be given at least 1 month before the monsoon season. And there are three kinds of vaccines which are used. The first one are the plain vaccines, and they are repeated after every 4 months. Similarly, alum precipitated vaccines, they, are, they contain the adjuvant alum, and they are given at the interval of 6 months. Similarly, another type of killed vaccine is the oil adjuvant vaccines, and they are given once annually. So you have to remember these three types of vaccine, killed vaccines, which are mostly used to control this disease, and these vaccines are easily available in Pakistan. Similarly, the other ways to prevent these diseases is by reporting the outbreaks immediately to the livestock authority, so that the vaccination can be done immediately in other healthy animals who have not yet contracted the disease. Similarly, quarantine measures to be followed, tracing carriers and culling them or slaughtering them, cleaning and disinfection of the sheds and farms, improvement of the farm management, and avoiding stressful conditions as we discussed earlier. So in this way, we can control and prevent this disease in our large animals. And you should remember that HS is also we can also one of the most important disease that affects our large animals, especially cattle and buffalo. Thanks.